Hello, I'm Dr. Anna Ogena. I'm a pediatric hospitalist in Anchorage, Alaska, and your current AAP Alaska chapter president.
Hi, and I'm Dr. Carla Laos, and I'm a pediatric emergency medicine physician in Anchorage, Alaska.
This audio recording is the first of what we hope to be an evolving podcast series for our Alaska chapter of the AAP to provide medical information and other highlights to our community pediatricians and other healthcare providers that care for kids. Today's fireside chat is meant to be part of AAP's infection control efforts for Project Firstline. Project Firstline is CDC's national training collaborative for healthcare infection control and prevention for our frontline healthcare workers and public health personnel. The CDC has released a training series available via social media, video, and other educational material for pediatricians and other healthcare workers. Basically, this means we are providing key takeaway information about the COVID-19 infection, how it's transmitted, how to protect ourselves, and where we go from here.
So it's been more than a year since the first confirmed COVID case, and the United States death toll is nearing 600,000. For our home state, the Alaska dashboard tally, available at covid19.alaska.gov, is just over 67,000 COVID positive cases, 362 total resident deaths, and over 1,600 total hospitalizations as of this last week in May of 2021. So we know the numbers, but we have a vaccine. How much longer do we need to be vigilant about infection control? Are we home free yet? Can we get back to business as usual already? The answers aren't that simple, but before we answer those, let's take a quick look back.
Yes, let's go back down to the hunker down phase in March 2020. What was going on for you, Carla?
Moving to Alaska from Texas, I was notified at the end of January 2020, and we had about 8 weeks to get here. This meant that we were on a plane with our 5 and 2-year-olds before COVID-19 was declared a global pandemic on March 11th. So for me, this meant uncertainty, fear, empty airports, and a plane that was also nearly empty without anyone wearing masks. Not only that, but we were moving to a new town where everything was being shut down, from grocery stores to restaurants and schools. The first public mask mandate recommended by the CDC was on April 3rd, which was my first day of work here. This was back in 2020. And in addition to this mask mandate, we were also encouraged to use proper hand hygiene and social distancing. So as a healthcare worker, it meant that my family was actually seeing me in a mask all the time. And I remember changing out in the garage when I would come home from a shift. And all that was just a lot. How about you, Anna?
You know, I remember the first health advisory that came from our chief medical officer, Dr. Ann Zink, and our health commissioner, Adam Crum, back mid-February 2020. And they basically hit us, with 4 recommendations, since COVID was a risk to everyone, including Alaskans. And those 4 recommendations were: number 1, wear masks; number 2, proper hand hygiene; number 3, social distance yourselves; and number 4, stay home if you were sick, so you wouldn't expose yourself to others. I remember that I would furiously come home or furiously wipe down counters and touch surfaces before we knew that COVID wasn't as transmissible via contact, but rather from respiratory droplets. I can recall the Clorox wipe shortage, that toilet paper was nowhere to be found. And since Purell couldn't keep up with the demand, hand sanitizer was also being made by distilleries. But more importantly, in all healthcare settings, it led to a PPE shortage.
The PPE shortage. Do you remember that? In my work setting, we actually had to reuse N95s. We were having to put them in paper bags and hang them on the wall with push pins so that we could get them to last as long as possible. And this kept up for weeks at a time. What was it like in the hospitalist realm?
Yeah, N95s basically went from yellow to red zone pretty quickly, and we were all in conservation mode. I remember mainly using surgical masks unless we were involved in aerosol generating procedures like intubation and suctioning. And I too would put surgical masks in a brown paper bag. I saw others put it in open Tupperware containers, for each day of the week, Monday through Friday, so we could recycle and reuse them a couple more times. And the hospital would even disinfect or decontaminate our N95s using UV or dry heat.
Interestingly, the USA was not able to ramp up domestic production because many companies had outsourced production to other countries. A lot of people don't realize that immediately before COVID-19 emerged, this meant that 50% of the world's supply of PPE was actually being manufactured in China.
Well,
so how about all those COVID myths versus facts?
Yeah, let's do a true and false round.
Sounds great. Let's do it.
All right. Number one, COVID-19 isn't as serious as the seasonal flu.
That's absolutely false. COVID is actually known to have increased morbidity and mortality when compared to the flu. What about this one? You can protect yourself from COVID by bathing, injecting, swallowing, or rubbing onto your body bleach, disinfectant, or rubbing alcohols. True or false?
Absolutely false. None of this should go into or onto your body. How about the COVID-19 vaccine was deliberately created or released by people?
That is false. Disease outbreaks happen, and they tend to happen when pathogens from animals mutate and then pass to humans. Let's try this next one. Ordering products from overseas countries can lead to COVID-19 infections. True or false?
That is also false. The World Health Organization actually says that the likelihood of this is low because of the length of time and the temperature changes involved during transit. How about young people can't get the virus?
That is false. COVID can actually affect all ages. Let's try this one. Household pets. Can they spread the virus? True or false?
That is false. Your dog or cat cannot spread the virus. How about if I'm healthy? So I can't catch COVID, can I?
That is also false. Personal testament would be that since we remained open throughout the pandemic, we did find and see patients who tested positive and reported no symptoms at all. And it also didn't matter if they were healthy or if they had known chronic conditions. So being healthy doesn't protect you from catching COVID. You're still at risk. What about this one? The virus spreads through 5G. True or false?
That's false. The virus cannot travel on radio waves or global networks. It spreads through respiratory droplets. All right. How about our last one here? A vaccine to prevent COVID-19 is available and safe.
That is true, which leads us to the next question. So Anna, what is the latest from the CDC as far as recommendations?
So the latest from the CDC, this May, and federal health officials said that if you are fully vaccinated, you can resume activities that you did prior to the pandemic. Let me say that again. Fully vaccinated people can resume activities without wearing a mask or physically distancing, except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including business and workplace guidance. Obviously, this does not apply to healthcare settings, correctional facilities, or homeless shelters. If you've been around someone who has COVID, you do not need to stay away from others or get tested unless you have symptoms. If you have symptoms, of course, get tested, stay home, and away from others. There's also other travel guidance that you can find on cdc.gov. So really, if you haven't been vaccinated, you should get the vaccine.
All right, well, let's talk a little bit about the science behind CDC's new guidance. We love science. The Pfizer phase 3 study did show how effective the vaccine was, and the scientists were pleasantly surprised with these results. The study was double-blinded. It was a placebo-controlled study, and it was a trial of over 35,000 participants, and it showed that the vaccine was 95% effective at least 7 days after the second dose of the vaccine. For comparison, it's important to mention here that the flu vaccine is only 50 to 70% effective, and that varies season to season.
There were also a few real world efficacy studies of the COVID vaccine in healthcare workers, since, healthcare workers were the first ones in line to get the vaccine. I know I was. The study showed that nearly 4,000 participants who had weekly PCR swabs, regardless of whether or not they developed symptoms, that illness and infection was reduced by 90% after vaccination series. This is a dramatic drop compared to the unvaccinated healthcare workers. Also, about 58% of infections were detected in participants either before or without symptoms. This demonstrates that people don't get as sick nor carry the virus, so there is much less incidence of asymptomatic infection and transmission in those healthcare workers that were vaccinated. This is compelling data. Again, to summarize, the COVID vaccine is effective at protecting you from getting sick, and the COVID vaccine reduces the risk of people spreading the disease. But what about those variants, Carla?
Great question. So Dr. Rachel Walensky, the CDC director, did state that the vaccines appear to work against some of the circulating variants, but it actually may be less effective against others. Remember, this presumes that people are fully vaccinated. So let's just clarify what that means. What does fully vaccinated mean, Anna?
In general, according to the CDC, people are fully vaccinated 2 weeks after their second dose in a 2-dose series of the Pfizer or Moderna vaccine, or 2 weeks after a single-dose vaccine such as the Johnson & Johnson Janssen vaccine. If you don't meet these requirements, regardless of your age, you are not fully vaccinated. So keep taking all the precautions until you are fully vaccinated. Also, if you have a condition or are taking medications that weaken your immune system, you may not be fully protected, even if you are fully vaccinated. Talk to your healthcare provider if you have questions. And even after vaccination, you may need to continue taking all precautions. Now, Carla, can you remind me what those precautions are again?
I sure can. So the vaccine precautions, they are to 1, wear a mask that covers your nose and mouth to help protect yourself and others. 2, wash your hands often with soap and water. And if it's not available, use hand sanitizer. 3, stay 6 feet apart from others who don't live with you. 4, avoid crowds and poorly ventilated indoor spaces. And 5, get a COVID vaccine. My daughter is actually half Mexican and half Peruvian. And as a person of color, it's important to highlight here the fact that COVID infections and deaths have affected African Americans and Latinos, as well as American Indian and Alaska Native people with disproportionate rates of hospitalizations and deaths. This isn't due to genetic differences, but rather social determinants of health. While at a cost, the COVID pandemic has brought social and racial injustice and health inequity to the forefront of society. It's only by striving to ensure health equity across the sectors that all communities will eventually be stronger, safer, healthier, and more resilient. We also have to remember that the vaccines are not yet accessible to everyone. So while the prevalence of COVID-19 infection is much higher in adults, we must remember that our children are still vulnerable. They're also a necessary part of the population that would contribute to overall herd immunity for the population. So it's recent news that teens 12 to 15 years old can be vaccinated. This is FDA approved. But what about those kids under 12 years old, Anna?
Pfizer is planning to apply to the FDA in September 2021 for an emergency use authorization for the vaccine in kids aged 2 to 11. Moderna likewise is conducting clinical trials in small kids for its vaccine. But currently, they're actually, reassuringly, there are a lot more families willing to volunteer in trials and spaces available in the trials. And historically, it's much easier to recruit kids for studies during active disease outbreaks. Let's keep in mind that COVID has killed more than 300 kids across the country, which actually represents one of the top 10 causes of death in children right now. And there have been thousands of children hospitalized. Of course, not all parents want to vaccinate their kids against COVID, and reluctance, especially early on, is not new. Vaccine hesitancy is more rampant now than ever before, but because we are pediatricians, we know how to counsel families about vaccine hesitancy and are quite skilled at it.
So we've talked about quite a bit so far. We know vaccine access is expanding to younger ages. We know how to maintain precautions, and we know that it's wise to consider getting vaccines to protect ourselves and loved ones. This is all well and good and means we can get back to work, right? Not so fast. Many of you might be asking whether or not your employer can require that you get vaccinated against COVID. We have to remember this comes from a good place. It's not so much another rule as it is with the intention of maximizing immunity and minimizing transmission. The goal would be to protect patients, staff, and therefore the overall community from contracting and spreading the virus. A fully vaccinated workforce is necessary for a safe workplace as we return to our normal operations.
That's good news. But before we wrap this up, we would like to share a few more reasons why you should get the COVID vaccine. And actually, this came from a few webinars and echo sessions that our esteemed state epidemiologist, Dr. Joe McLaughlin, shared with us. Number one, the vaccine provides excellent protection against COVID-19, especially severe illness and death.
Number two, if you don't get the COVID-19 illness, you won't get long COVID. And this is a syndrome of fatigue, brain fog, cough, shortness of breath, joint aches, etc. And it can affect people for weeks to months after the initial bout with the disease.
Number three, vaccines provide better immune response than natural infection and likely longer immune protection too.
Number four, the vaccine is free. COVID-19 is not, due to missed work and hospitalization, which averages $10,000, and ICU costs, which have been averaging $40,000.
Number five is it's good for the economy. The more people get vaccinated, the sooner our economy opens up and we can get back to normal life.
Number six, you don't have to quarantine if you get exposed to someone with COVID-19.
And number seven, you can have social interactions with other vaccinated persons without masks or physically distancing. Well, I'm glad both you and I are already vaccinated, Carla. That's plenty of incentive to get it done.
That's true. It also means we can go grab lunch now.
That's true. Thanks for tuning on. But I want to thank everyone for tuning in and listening to us today. For more information on infection prevention and control, educational videos and resource links, please check out CDC's Project Firstline. Thanks for your time. Be well and stay safe, Alaska.
Take care.